Okay, good morning. Welcome. I'm Mark Pinto from the Phoenixville Public Library, and welcome to another of our community services spotlights. Since 1999, Phoenixville's healthcare access has been connecting uninsured and underinsured residents of the Greater Phoenixville area with specialized healthcare services. And we're pleased to have with us today the Executive Director of Healthcare Access, Tracy Shantz. Good morning, Tracy. Take it away.
Good morning, Mark. Good morning. Thank you so much for allowing us to have this opportunity to spread the word about what we do. So, as you said, Healthcare Access celebrated our 20th year last year of serving the Greater Phoenixville community. We help people who don't have insurance, but we also help people who do have insurance but don't have coverage for certain things. So a lot of people don't realize that a lot of people are still uninsured. There are a lot of opportunities for insurance, but there are still many folks who can't afford or are not eligible for insurances. So I'll talk about first who we serve. We serve the Greater Phoenixville area, which is literally a large circle around Phoenixville. There's 19 townships and boroughs that are part of our service area. A lot of people have Medicare, people over 65, and some people qualify if they're lower income for Medicaid through the state insurance programs. And some people even qualify and purchase insurance through the Affordable Care Act, through the Obamacare. But a lot of those insurances do not cover some of our program areas, particularly vision care and dental care. So we're helping the uninsured, but we're also helping the insured get those services. So let me just give you a quick overview of the 5 current programs that we offer. I'll start with our dental program because our dental program is the largest need. Dental care is expensive. If you go to the dentist, you're going to know that it's not cheap, especially if you don't have insurance. So a lot of people who don't have dental insurance, whether they're uninsured or whether they have other products that don't cover dental, those are the folks we're helping get care. And how we do that is through a network of providers. We have 16 dental providers in the community who have agreed to work with Healthcare Access. They provide the care right in their own practices, and we provide the funding. And they, because they know we're a nonprofit, they offer us reduced fee schedules. So the client goes to the dentist, gets the care they need, we pay the dentist, client might contribute a copay towards the cost of the care, and then we cover the rest. So our dental program for children is pretty extensive. We cover everything except braces. For adults, it's a little bit more limited in scope because of the cost again, but we do cover basic cleanings, exams, x-rays, fillings, extractions. We help with the cost of dentures. So it's pretty good scope of care for adults and certainly for children. So our vision program is our next highest utilized program, and it's the same premise. We have a network of local vision providers who provide the care, the eye exams and glasses or contacts to our clients that we refer to them. And we currently have 9 partners, 9 vision providers that we work with. So again, client comes in, gets screened, we refer them directly to the eye doctor. They go, they get a complete comprehensive vision exam, and if they need glasses, then they'll get a pair of glasses as well. And we provide the funding again at a reduced fee schedule. The vision providers give us the same courtesy. So that's how those 2 programs work. The prescription program that we offer has 2 components. We help people with emergency prescription fills. For instance, if somebody is getting out of the Phoenixville hospital and is uninsured needs an antibiotic to complete their course of treatment so they don't, get sicker, we will pay for that prescription for them at a local pharmacy. We have 2 pharmacies that we work with in Phoenixville. Again, they give us a discount on the prescription medications. So the client goes to the pharmacy, picks up the prescription, and we take care of the cost for it. And that's very effective for people who are particularly getting out of the hospital, so that they don't get reinfected, or they can recover from whatever illness they're in. And we have helped people with insulin, and obviously that's a life-sustaining type of medication. So we will cover those types of medications for people that qualify and that don't have insurance coverage. The other part of that is that if people are experiencing a hardship, say they, had a car bill and their rent just increased or whatever, and they run short on a particular month, we will pay their co-pays, even for people who do have insurance. It's a one-time assistance. Obviously, we can't pay somebody's co-payments for their prescription medications month after month, but we will help them out in an emergency situation. So we do emergency prescription fills at the local pharmacy for people in need. So that's very helpful to a lot of people. We do have people over the course of years know we're here, and they'll come back when they know they're struggling. And, if we can get them over the hump with that one prescription fill, then wonderful. So we do use our funding to help people get their necessary prescription medications. The other component of our prescription program is that we help people access the drug companies' programs. They're called PAPs, which is abbreviation for Patient Assistance Programs. A lot of the drug companies, Pfizer, GlaxoSmithKline, all the ones that you're going to recognize their names, and some even new ones, they all have patient assistance programs for some of their higher cost brand name medications. So if you are just put on a medication for cholesterol, and it happens to be a brand name, that's the one that the doctor has recommended, we may be able to get that prescription through the drug company for you for free. It's a whole application process. They do require proof of income. They do require a doctor's signature on the application. And that's what we help people articulate. We help them get through that whole application process. We actually have software, a database software that helps us generate all those applications, because there are a lot of drug companies. They all have their own criteria for eligibility, and they all have their own applications. So it can be cumbersome. We might have one client on 4 different medications with 4 different drug companies. So that's the process we help people get through. And we help people even network with their physician. We'll send the application to the physician, get the signature that we need, get the proof of income from the client, and send it in to the drug company for the patient. So it's a big, it's a service that we provide. And our goal is to get people their medications. So there's twofold component, the emergency prescription assistance, and then long-term help with people getting their medications through the drug companies. And I can tell you, we've had some clients that have been with us for years because they continue to qualify and they're on a chronic medication. So we just keep that process up of getting them requalified every year. Every 3 months, they get a 3-month supply of medication at no cost, which they can maintain their medicines, thus maintaining their health. So that's been an important long-term program for us as well. So the next one I will talk about is our free mammogram program. That is actually a partnership with the Phoenixville Hospital and the University at Penn Radiology, because somebody has to read those mammograms. So we've been in partnership with those 2 agencies for many years, And our goal is to offer uninsured women free mammograms. And we do have a lot of women coming back to us every year because they remain eligible. They continue to be uninsured. So they come back every year on an annual basis and get their mammogram. Very important screening. Any woman over 40 should be getting their mammograms either annually or however often their doctor recommends. We have had several, I would like to not say many, but let's say several women over the years who have actually been diagnosed with breast cancer. And there's more resources available for women who are actually diagnosed with cancer. But that screening tool is critical. And so we're proud to have that program available for women in the community. Now, for that program, our service area is pretty wide because our goal, and we can handle the amount of need, we extend that out a little further. You know, if you live in Pottstown or Norristown or in the surrounding area, we will provide a free mammogram to women. So we know we can handle the need. So it's just one of those screening tools that we want every woman to take advantage of if they can. And then our last program is a little bit a different program. It's an immigration services program. And the goal of that program is to help immigrants in this country figure out what might they be entitled to through the immigration laws here in the US. And we have a dedicated staff person for that program. She had to be trained. Her name is Marjorie. She had to be trained and qualify because our agency had to go through the Department of Justice to get accredited and recognized for this program. Not any nonprofit can just create an immigration services program. We are recognized by the Department of Justice and Homeland Security and all the entities that govern our immigration system in the US. So Marjorie completed all the training necessary for that program, and the agency applied for recognition. And that's a certification that you have to keep up with. You have to they keep changing the rules, but I think it's every 5 years we have to requalify. So she can provide immigration services to immigrants. And it's basically legal services. Part of that program, we are encouraged to collect nominal fees, nothing near what you're going to pay at a regular immigration lawyer. That's the whole premise of the program, to, again, create access for lower income folks who can't afford a lawyer, but need legal advice and legal assistance. So we do charge for consults and for the immigration services that we provide. Certainly for any of our programs, if somebody can't afford a copay at the dentist or our legal fees or a contribution towards their care at the eye doctor, we waive those fees. We have found over the years that people want to contribute something towards the cost of their care. It helps them feel like they are having and playing a part in their health, which we think is important. But we certainly don't prohibit them from getting the care if they can't afford a $10 copayment at the eye doctor. We certainly will waive those fees whenever necessary, so that our goal is always to provide that access to care for everyone who needs it. So even though the immigration services program collects fees, we will, for hardship reasons, waive those fees as well. So that's kind of a quick overview of all the programs that we provide. We have a lot of partners. Obviously, we have a lot of dentists and a lot of eye doctors who, if not for them, we wouldn't be able to have the network of provider model that we do. We work very closely with the local hospital, as I mentioned, and also the local medical clinic called the clinic, in terms of coordinating care, because we're all serving the same population. And we refer our clients to all the other agencies in Phoenixville all the time. If we know somebody's struggling with food, we refer them to PACS, and vice versa. We take referrals from all the local agencies as well. So that's kind of a quick overview of what we do. We're a small staff. We are based in Phoenixville. Clients don't necessarily need to come to us. If they can't get to us, we can articulate processing their application over the phone. We try to keep that process as accessible and simple as possible. We do look at income. Obviously, we want to serve the lower income population that can't afford care, although our guidelines are pretty liberal. And we do request, proof of residency so that we know that they live in the area. But those are the only two requirements that go along with our application process. And like I said, we can do that fax, phone, internet based, to get the application information that we need. And we're open all the time to different agencies helping with that process. We've certainly gotten applications faxed to us through Orion or the school district even. We're willing to work with everybody in terms of making access to our programs as easy as possible. So I didn't know if anybody had any questions. If you think I missed anything, Mark, I can talk and talk and talk, but we certainly want to keep it informational.
Oh, thank you for all that information, Tracy. Are there any questions? Feel free to unmute yourself.
Well, I apologize. My audio was not working or connecting earlier, but I thought I would just kind of introduce myself. But I'm Jamie. I work with the Nurse Family Partnership of Chester County. I don't know if y'all are familiar with that. Yeah. My clientele has kind of started in the Phoenixville area, and now with telehealth, we're all virtual. We're not doing home visits currently, kind of expanded over the entire county. So any chance I get to kind of hop on and just updated information. I know COVID is having a huge impact on a lot of services and whatnot. So I appreciate all of the information. I guess my only question would be, from the referral then, what is kind of, and you said the application, is there assistance in like setting up appointments? I have a couple clients who have had questions kind of about like locations of certain offices and that sort of thing. They've needed kind of clearance from their OBs to be faxed over, that sort of thing. Is there anything that I should kind of be tuning into in terms of like the appointment scheduling and any restrictions with COVID or anything like that going on?
So early on, of course, when the mandatory shutdowns were happening, we did shut down our offices as well. And a lot of the dental and vision providers had to stop seeing clients. However, we are fully operational. My staff does go into the office. We're doing everything as safely as possible. So clients are coming in to see us. It's not mandatory. Again, like I said, if we can get the information that we need, we can do everything right over the phone. And we can communicate directly with the providers that we're referring clients to make sure that they know who's been approved for what services. So we are fully operational, and all of our dental and eye doctors are up and running. Each practice has their own set of COVID restriction type rules, but they're pretty standard, wearing masks, hand sanitizing as you come in, they're taking temperatures, like we're doing all that stuff too. So we've kind of gone through that bad period where nothing was happening, and now everything is pretty open, and there's no waiting list for any services. We have plenty of providers that are seeing clients. So the referral process for us is back to normal, which is a wonderful thing. And it really was only compromised for 2 months when the mandatory shutdowns were there. But since then, we have been having staff work remotely, but in person as well. So we're up and running and ready to serve the community and processing applications. And the easiest thing for people to do is call us. And I know, Mark, I saw in the chat, you put our phone number, 610-935-3165. We do an intake to make sure somebody's eligible before we put them through that application process. Then the main thing is where they live. You can see the list of townships and boroughs that we serve on our website, and that is at www.hcaphoenixville.org. And that is listed under our eligibility section, so that people can tell very quickly whether or not they're eligible for our services. That is probably the one black and white thing about us. We're very flexible. We very seldom have to disqualify anybody in terms of income. Most of the people that call us are going to qualify, but you do have to live in our service area. We are a community-based program, and we get our funding from the local Phoenixville Community Health Foundation. So our service area is kind of their service area. And like I said, it's a pretty big circle around Phoenixville. But everybody has to stop somewhere. But as long as they are in our service area, we can screen people right over the phone, just a simple phone call. That was probably a very long answer.
No, I appreciate that. I definitely appreciate that. And it's good to know that you guys are kind of like up and running and everything is functioning well. How about like bilingual services or translators?
We do have bilingual staff on board.
Awesome.
Yeah, we have, I have a staff person who speaks Spanish, and I have another staff person who speaks Spanish and Portuguese.
Awesome.
So we can handle Spanish speakers and Portuguese speakers, not a problem there. We might have to get back to them, but we definitely, and we do, we serve a large Latino community because we have a large Latino community living in Phoenixville, and those folks are uninsured. So we do service that community and have developed a good trust level with them. And honestly, word of mouth is our best referral source when it comes to the community. So, but yes, we do have bilingual staff.
Okay. Wonderful, thank you.
Mm-hmm. We also, just as an aside, one of my staff people actually goes and accompanies people at their visits with the dentist or the eye doctor if they don't have any bilingual staff, and if they don't have a family member to help, because we feel it's important for that continuity of care. We provided an interpreter at the visit to interpret for the doctor, the eye doctor or the dentist when we need to. So that's also a service that we provide to our clients.
Awesome. And I could have sworn, but I could be mistaken. Transportation, did I see something or hear something about, or do you guys not do transportation services?
So we don't directly do transportation services,
okay.
But Phoenixville has a Ride for Health initiative program. And through that program, which we are a part of, we are a partner with Ride for Health. If one of our clients comes in and they need to get to one of our dentists, for instance, we have a pediatric dentist in King of Prussia. So every once in a while, we have a parent who just can't get to King of Prussia. So we will arrange a ride through the Ride for Health program. And basically, it's a taxi ride through that program to get them to their medical appointment and back. So there are transportation options. Luckily, Phoenixville has that resource, so we tap into that when we need to for clients so that they can get to their appointments.
Same sort of process in terms of, would that just be something that they mentioned needing would be the transportation? And would there be any sort of special qualifications or like anything else necessary to receive?
If they qualify for our programs, they're probably going to qualify for the Ride for Health.
Okay.
because it's the same kind of community-based program. And really it's if they don't have other transportation.
Got it.
And that, you know, we screen people because we know what the program guidelines are for the Ride for Health. But yeah, if they qualify for our programs, they're probably going to qualify for that program as well if they need a ride. And we get involved with that a little bit because obviously we want to make sure people keep their appointments. And so we do ask them, are you able to make it to your appointments? Is transportation an issue? So we do try to cover that because we don't want them to miss their appointments.
Right. Okay. Awesome.
Okay. Great questions, and thanks for
Yes,
those
thank you.
answers too, Tracy. And so Jamie, thank you for tuning in today.
Yes, thank
And thank you everyone who is watching this video on YouTube, tuning in as well. The fact that healthcare access has been around Phoenixville since 1999 definitely attests to its success and its ability to meet the demands of the Phoenixville community. So Tracy, thanks for your time this morning and
Thank you.
sharing about healthcare access.
Thank you so much.
All right. Take care now.
Yes, you too.
Bye. Thank
Good
you.
one. All right.
Bye-bye.
Bye-bye now.